I'm Howie, and if you're ever curious about where you go when you're sick down in Antarctica, you come here, McMurdo General Hospital. Let's go see if the doctor's in. Is Dr. Harry in?
Yes, he is.
Yeah?
Why don't you come with me?
All right, thanks.
This is Harry.
Hi, Doc.
This is
Howie.
Howie.
How are you?
Nice to meet you.
Yeah.
I'm doing fine.
It's good to see you today.
You might want to take your jacket off. It's going to get hot in this building.
Yeah,
with
these
your
coats
partner.
big reds are kind of warm. Thank you. How long have you been here in McMurdo?
This is my third summer season. I come down in the Antarctic summer, so it's third in a row.
Uh-huh.
But I started out many years ago up in the Arctic, so
Right.
I'm bipolar.
You're bipolar. Was that treatable here?
That's true.
What's the craziest, wackiest thing you've seen here as head doctor?
I'm not sure I've seen things that are crazy or wacky. What's maybe some of the more serious patients? Last year we helped the Russian science vessel. They had a man with a ruptured appendix. Their doctor had operated. Then when they got close enough to us, they were able to use their helicopter to bring the patient here.
Mm-hmm.
We continued to care for the patient until we got a plane down to take them back up to New Zealand, and he did well.
So I noticed you have this pop-up book of phobias on your table here. I mean, do I really need to be worried about snakes?
We have no snakes down here, no.
In Antarctica?
Only in our dreams. Right.
So I guess this is kind of a gag then, huh?
It is. We try to use humor in general throughout the station. You'll see that as you tour around. There are going to be cartoons on the walls and things of that nature. Well, that's one of ours here.
Trying to keep it light.
Try and keep it light.
Yeah. Well, I wonder if you might be able to show us around the medical facilities a little bit and what goes on here and maybe some of the history of the building and
We can do that.
yeah, that would be fabulous.
You've just gone by 2 patient areas with the drawn curtains,
Uh-huh.
and I'll take you around the rest of the way.
Great.
This is our kitchen and our meeting area. These are office areas here.
Uh-huh.
I'll take you back to our hospital section.
In your meeting area, do you have daily meetings,
We usually
updates?
do. Yeah,
And,
we have staff briefings, things of that nature.
uh-huh.
And that's also a recreational area because that's where the kitchen is.
Right. So it's a
And,
big meeting
that's where
spot.
the coffee is.
Yes.
and the hot water for tea.
Uh-huh.
This is our hospital unit, which, because we have no patients here currently, we're using to stage some of our packing. Back there are field kits that will go out into all the field stations once we start going into the field. I'm going to take you into the room where we have the hyperbaric chamber.
Great.
All right.
I'd love to see it.
As you know, we've got divers here. And when we have divers, there's always the concern that if we had a diving accident of the bends, nitrogen narcosis, if we had that problem, how would we fix it?
Yeah.
Well, they put this, this building was actually, this part of the building was added to the clinic in
Uh-huh.
subsequent years. And our dive master, who's been coming down for 25 years in a row, is the chief man that runs this, and then some of our medical people are trained up. So here's the chamber.
Great.
And this, here we go. Okay, here's our barrel chamber. We'll let you get in and see what it's like. Here's some reading material, the phobia book. There's a good chapter on claustrophobia. You might
Thanks,
wanna
Doc.
read
I'll take it with me. Yeah.
Not when you want to come out.
All right, Doc. So this has been a look at McMurdo Medical, but no visit to the doctor would be complete without one more thing. Do you mind if I have a little sit down in your waiting room?
Go ahead. Go ahead.